Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're going to talk about the absolute best self-treatment for bicep tears and tendonitis.
Okay.
We're going to do both. We're going to cover it. Yeah,
that explains a little bit here.
Yeah, actually, the reason I got this in here, Brad, is if you actually tear the long head of the bicep.
Sure.
Bicep means two, or bi means two.
Right.
That means it's got two attachments up here,
Right.
this muscle. But if you tear it, it'll gather down here, and you'll have this big bulbous thing here.
And that's your muscle belly.
Yeah, coming down here. And that means you tore the long head, and that means you either have to have surgery or you're going to be like this the rest of your life. I mean, it can't reattach on its
Right,
own.
because it'll break off, and that tendon will come way down, and in your bicep gets like you've been doing curls for a long time.
Yeah, exactly.
But it's not very comfortable.
So let's show first, Matt, Brad. I was going to call you Matt, my son's name. Where the bicep tendon.
Yeah, let's look at that a little closer here.
And bring that up too, Brad. That actually works out really good.
Yep.
So, am I close enough, Lonnie? So you can see right here, there's a groove right here, and that's called the bicipital groove, which means the bicep actually comes up here and attaches to the top of the glenoid right here, and it also attaches over here. That's the other attachment.
That's the short head?
That's the short head.
Short head and the long head.
Yep.
That gives you your bi.
Supraglenoid tubercle or something like that. It attaches up in here.
Yeah.
It goes down here,
We
then
knew
it
it in
attaches down
school.
here.
Sure.
And it helps, it actually helps bend the arm, but it also actually supinates the hand.
Right.
So the forearm. So the bicep does this and this.
And a little bit of shoulder flexion.
A little bit of shoulder flexion. Yeah, good point.
Because it's bi-articulate.
Yeah.
Going back to school days.
So you want to show the tendon on there?
Okay. So this is actually the, if we take the scapula off, and here's the rotator cuff muscles, and we pull this out so you can see the long head
pull
of the
this
bicep.
bone out right there.
Sure enough, right there, here goes just the end of the bicep muscle, which is cut off there, but then here's the long head, goes up around this groove right here, and attaches to the point Bob was just talking about, and there you go.
So this is going to help you with the assessment process. Like when you are trying to determine, is it bicipital tendonitis that you have, you want to find that little groove on your shoulder and rub across it. And if it's sore, there's a good chance that, that may be, part of the problem as you're having a little bicep tendonitis.
Right. So yeah, you get right in there and you feel back and forth across, and you usually can get to it. If you've never done this before, you probably don't know what you're feeling for, but as a therapist, we get to it pretty quickly.
It's a good start to try to figure out. But we'll show you another test you can do too to figure out if it is the bicep. Now, tendonitis tends to come from overuse injuries. It means that you've overused the shoulder, but it also bicep tendonitis often comes about when the rest of your rotator cuff isn't working right.
It's being overstressed.
Yeah. So the rotator cuff is 4 muscles. It's not the bicep. It's 4 muscles that go around the shoulder blade here. And if they're not working right, the bicep comes in to try to help out some more. Right. So at the end, we're going to show you maybe some exercises to do for the rotator cuff too.
Right. Yeah. So those are the muscles I referred to. If we pull that out, here they are. They're flat, broad muscles that really support that joint. And so anyway, Bob, there are some people that have never seen us before.
Hi. Welcome to our channel. Please take a second to subscribe to us if you are new. We have a subscription button over here and down here. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
Excellent, Bob.
Well, I've been forgetting that one.
Those new people, they see the Gumby.
Yeah.
They wonder what's going on.
They're wondering about us, and we do too. So let's first just show 3 quick tests you can do, Brad, to rule out or to verify that you have bicipital tendonitis. So the first one is, sometimes pain can come from your neck and go down into your shoulder.
Very common, yes.
Yep. So we're going to do the Sperling test, where all you do, it's very simple, all you can do is turn your head and go back like this, and then you're going to push down.
Yeah, go ahead.
Yeah. It's good if you have somebody else do it, actually.
Yeah, and then I'm going to gentle pressure.
Gentle pressure,
This is not a big push.
Yeah.
I can get plenty of pressure from here, and I'm not pushing hard, as you can tell.
Now you're squeezing the bones together, and if there's a nerve problem, if there's a pinched nerve, you're pinching it even more, and it'll send pain down your arm.
Yeah, you do that, and they'll say, oh, it hurts over here. Then you know it's probably not the bicep.
Did you mess up my hair, by the way?
Yeah, we'll have to comb it out. We'll get it after the video.
A few hairs that are left. Okay, the next one that sometimes will send pain down into the arm is thoracic outlet syndrome.
Sure.
So this one is called the Roos test. Very simple to do. I don't know what rooster, it's like, sounds like rooster, doesn't it?
Right, that's what I always think about.
So you bring it up and you bring the shoulders, the elbows back a little bit too, and all you're going to do is the chicken dance.
And how long are you going to do that for?
About 15 times.
Okay. And if it's positive,
It'll start recreating the symptoms down your arm.
Right.
So that's one test for it. Obviously, if you have it positive, then you may want to see a doctor and figure out what else is going on.
Sure.
So now this is the test specifically for tendonitis itself. It's called the speed test. It's easy to do, and that's why I picked this one, Brad.
and this is more specific to that tendon. I like this one.
Yeah. So what you do is you just stand with your arms straight like this, okay? And you might have somebody else do it, or you can do it yourself. And all you're going to do with the arms straight and it opened up completely like
Right,
this.
so his palm is
Palm facing you.
Thumb is out that way?
Facing away,
Right.
facing Lonnie.
this way,
Yeah.
this way.
You're going to do just give some resistance there. And if you do that resistance, if you feel it up here, that means it's likely you have some bicipital tendonitis.
Go ahead and do it again. As a therapist, this is what I do. Stand right there, palm out. Okay, don't let me move your hand. Hold, push, push.
Yep.
Any pain with that?
No.
No.
So I don't have it.
Right,
Or yes. Or another way to check it, is you can also check it up here.
Same thing, palm
Same
up.
thing, yep.
Hold it right there.
And now reverse, what you can do is you can actually turn it this way and try it
Okay.
again.
Yep.
And now it doesn't hurt, and now it doesn't hurt. Very points really towards bicep tendonitis.
Sure,
So,
okay.
all right, we better get into treatment here, Brad.
Yeah.
All right, the number one treatment that we like to do for this, and it responds typically very well, is cross fiber friction
Yeah,
massage. So you got to find, you're gonna put your arm, up on a pillow so it's nice and relaxed at that 90-degree
There you
right
go.
angle.
Yep.
And you're going to have the arm, I don't want it in like this, I don't want it out like this, I want it just straight forward like that.
More in that neutral
Yeah.
position.
And you're going to go ahead and you can do this through a shirt, or you can do it with the sleeve up.
Right on the skin.
But you're going to find that tender spot, and this is what may take a little bit of palpating.
Right.
And you're going to rub across it. And I'm rubbing, you start off generally kind of soft.
Right.
And then you work up to the point where you're rubbing very, very hard. But I'm rubbing right across the tendon.
Yep. Remember, the tendon goes up and down, so we're going across it. That's why it's called a cross friction massage.
And what has happened usually with that tendon, there's scarring and there's maybe even slight little tears in it. And this helps it heal by getting more blood flow to it. And it also helps break up the scars so they heal strong.
Right.
Because what happens a lot of times is you start using it and it was getting better, and all of a sudden it hurts again because those scars broke open because they're not as strong as regular tendon.
And the key thing with this is once you find it, that sore spot, you can start working it and put some pressure deep into it. If it hurts right away, that's normal, but after about 30 seconds, it should clearly be improving. I just
30
did this-
seconds to
yeah.
a minute, I would say. I mean, yeah.
I just did this yesterday to someone with an ankle sprain, because you can use this on any joint, anywhere in the body, and it's pretty clear. It starts to feel better, or they say, and I've experienced it myself, it feels kind of numbish. That's good. That means keep
That's
working
a good
it.
sign. If not, you may want to put some ice on it, and back off for a couple days and then try it again.
Right.
So that's the number one treatment. A lot of times you can do this for a couple weeks and it goes away. Syriacs, who invented this, said 20 minutes every other day. You can't do this for 20 minutes. I don't know of anybody who can do this for 20 minutes.
Your fingers get sore.
Yeah. So if you do 5 minutes here, 5 minutes there, you could even do 5 minutes twice a day.
Right.
Just again, we're breaking it up.
Yeah.
All right. Let's go to let's say you actually have a tear, Brad. You're having the pain in the mid muscle here instead.
Okay.
And this usually came from a lift or something.
Right.
This isn't overuse. You lifted something that was too heavy for you. You usually feel it in the middle of the belly, muscle belly. You're going to treat it the same way. You're going to go ahead and you're going to find that tender spot on there and you're going to rub across it. Again, I'm not just pushing skin. I'm getting down deep into the
Right.
muscle.
Yep. So it's right in there.
Yeah.
He's got his shirt on, so it's hard to see. But with my massive bicep, you can people can see. Yeah.
I'm going to need my glasses. All right. Do same thing, same guidelines, 20 minutes every other day, but you could go ahead and just do it 5 minutes here, 5 minutes there, and break it
Right,
up.
right.
These, again, respond very, very well to the massage. After that, you're going to want to start doing some strengthening. Now, the big problem I see with a lot of weightlifters, they go back and they just start lifting the same weights. You can't do that. You got to start off light.
Yep.
I mean, you got to.
Build that muscle. It's got tremendously weaker after this injury.
Right.
You need to come after it appropriately and progressively.
And the good thing is just to start with a light weight, and it's good to start with the arm even pronated like this.
So
and
palm away.
palm
or
away,
down.
and then go into supination, because again, that's what the muscle does.
Right.
It bends the elbow, and it also supinates the forearm. So
And look at Bob's doing full range of motion. I see so many people doing curls and they just do little short ones. Of course, they use their body to get heavier weights, but good quality, full range of motion, along with the twist and the pronation, supination.
and you can even do some eccentric ones if you want to.
Sure.
You could do a heavier weight and lift up
Yep.
with the other arm, and then lower it down.
That's in the early phase of
In the
strength.
early phases.
Yep.
In the later phases, Brad, if you want, go to a pull-up bar, go onto a chair, lower yourself down, get back up into the chair, lower yourself down. You know, just keep lowering yourself down. for
Right, so you're
biceps.
pushing your body up with your feet and lowering it with the control
Body,
of your
right.
hands and
You want
arms.
to show with the band, Brad?
Sure. So with the band, I'm just going to use my foot for an anchor, and I'm going to go up to here. And again, you can still,
You still can do the supination there.
palm is up here, and I rotate, now the palm is away. Up, full range of motion, and away. And if you can do 3 sets of 10 and it's easy, you know, it's time to do more, you know.
Now he doubles up.
Yep, simply just double it up. You know, you can do that with the same color TheraBand or TheraTubing. And of course, you're gonna, you know, if you're in a gym or at home, you have multiple colors of TheraTubing. You can just increase the resistance appropriately.
And the
by-
same with weights. You know, over time you can do. I mean, what other 864 ladders or what? You know, when they do ladder training.
Pyramids.
Pyramids.
Yeah,
Is that what it's called?
That's what I call them. But
So, all right, that should do it. That should take care of your problem. And remember, Brad and I can fix just about anything.
yeah, but we're working on this. That broken heart, Bob.
That broken heart.